At Cardiosource World News, we certainly know that the Emphasis HF study has been critically important in giving us a lot of information about heart failure. So I want to introduce you to Dr. Faiez Zennad, who is from the University of Lorraine in the city of Nancy in France. And this is a paper that's coming up in JACC looking at the safety and efficacy of eplerenone. First off, tell me why you did this analysis from Emphasis HF.
Yeah, well, the Emphasis HF is essentially a trial in mild moderate heart failure, which has shown that eplerenone is effective in preventing morbidity and mortality, hospitalization, and prolonging life. But there is an issue of safety with these potassium-sparing diuretics. The issue is that in the perception of many physicians, this potassium-sparing diuretic is sparing potassium, so there is a risk of hyperkalemia and in some cases worsening renal function. Now, the doses we have been using in this trial are very, very low, and the potassium-sparing properties and diuretic property are extremely weak. But still, in patients at risk of developing hyperkalemia or developing worsening renal function, there is some concern, which is making doctors hold back, not much using these life-saving drugs. So we thought we should analyze the worst-case scenario, the patients who are at high risk for developing hyperkalemia and worsening renal function, and find out whether they are still benefiting from treatment. And we know that there are patients who are at risk because they are diabetes, elderly, poor renal function to start with, or marginal upper limit of potassium at baseline. So we picked up all these subgroups and we tried to do subgroup analysis and do the risk to benefit ratio in these population. And the simple conclusion of this analysis is that no matter how is the risk of the patient population, the benefit overwhelmingly is larger than the risk. True that elderly patients with diabetes and or with poor renal function, they have a higher rate of hyperkalemia with eplerenone than on placebo. True that they have more frequent worsening renal function, but at the end of the day, the life-saving benefit is much larger than the risk of hyperkalemia worsening renal function. True as well that hyperkalemia worsening renal function would expose the patient to a high risk of cardiovascular death, for example. But again, the balance of benefit-risk benefits are exceedingly higher than the risk.
Now, what kind of doses were these patients on?
So typically, eplerenone was in this trial used at 25 milligram, which eventually could be up titrated to 50 if potassium stayed within the margin below 5.5 and if there is no worsening renal function. In patients who would run into higher potassium or would worsen EGFR, the protocol instructs the investigator to down titrate these to 25. So if any, the dose is anyway between 25 and 50, and to my recollection, an average in all the populations was about 39 milligram, which is an extremely low dose. In the hypertension program with eplerenone, the doses, antihypertensive doses were above 200 to 400 milligram, right? So we are at very low doses, which are potentially acting mainly on cardiac remodeling, fibrosis, inflammation, not much on the sodium-potassium exchanges and diuresis and the kidney.
So even in high-risk patients, consider eplerenone for those where it would apply.
Yeah, this is the bottom line, and this is the main message. And actually, the risk is higher, but the benefit is even much higher, because when you start with the high absolute risk, the high absolute benefit is even higher. So there is no reason to deprive these high-risk population, high risk not for safety only, but high risk for cardiovascular mortality. There is no reason to deprive them from the life-saving benefit of these agents.
And this paper is coming up in JACC, and you'll get the citation in just a moment. Safety and efficacy of eplerenone in patients at high risk for hyperkalemia and or worsening renal function, and this is an analysis of Emphasis HF. For Cardiosource World News, I'm Executive Editor Rick McGuire.